A rise in cases across several states is causing fresh concern among public health officials, and a particular worry is this weekend's crowded Trump rally in Tulsa. I spoke earlier with Dr. Imran Ali. Dr. Ali, let's start with the president's rally over the weekend. Not a full house, but thousands of people right next to each other. We knew the coronavirus concerns before. What else did you see that concerned you? And what should health officials, those at the rally, and even those who know someone who attended the rally be focused on right now?
You know, we didn't see a full house, but we did see, by some estimates, approximately 6,200 people. And I looked at the crowd video, and I would say, just by looking at the video, 90% of them did not wear face coverings, and they were very close to each other. And we do know that, this virus, according to research from the London School of Hygiene and Tropical Medicine, may have a dispersion factor, or what we call a K factor, which is very high. That means 10% of people who are infected may account for up to 80% of the viral spread. A study back done in March showed that by just one church in Arkansas, 92 churchgoers attended, and 35 of them ended up positive for COVID. And then also think about it that they have to go back to their communities, and they can spread the virus by bringing it to people who did not attend the event. And this is very concerning. We won't really know the impact for another 10 to 14 days, but it really is very concerning. And that's why we're really trying to make sure people don't go to crowded arenas.
Comedian D.L. Hughley was performing over the weekend. I'm sure you saw when he collapsed on a stage in Nashville. He was treated for exhaustion and dehydration and then tested positive for COVID-19. He says he's asymptomatic, no fever, no cough. Hughley is going to quarantine in his hotel in Nashville for 14 days. Most are assuming this morning that that collapse was linked to the virus. Would that be correct?
It's hard to say. I have personally treated patients who did not exhibit the particular classic symptoms of shortness of breath. Just simple fatigue and lack of appetite was just enough for me to trigger a COVID test to find them that they were positive. So it's very hard to say. I didn't look at the laboratory results, but usually, dehydration can definitely cause you to collapse, faint, because you get your blood pressure drops, and you don't get that perfusion or the blood flow to the brain, and you can collapse from that. But also the sodium and potassium and other electrolytes, which are controlled by our kidneys, can be affected. And we are knowing now that COVID does indeed, in fact, affect the kidneys. But I don't have all the information from his particular case. But it is concerning because we are seeing, atypical presentations of this virus. It's not a respiratory virus only.
Our thanks to Dr. Ali, and we're hoping for a speedy recovery for Mr. D.L. there.